said earlier, we're proud to partner with Southtowns Radiology to go pink for this week for breast cancer awareness. We spoke to one of the radiologists there about how he uses technology to provide patients with a picture of their health. So this is definitely a segment you're going to want to take notes. The key to beating breast cancer is early detection, and a mammogram is every woman's first step in maintaining breast health.
A mammogram is the best tool that we have to detect breast cancers early, and the idea is that we can find them earlier and treat them and give patients improved survival, which is the ultimate outcome that we're looking for.
Well, mammograms are a common practice. Not everyone understands exactly what they are.
A mammogram is a technique that uses low-dose X-rays, so there is a machine that develops those X-rays. The woman's breast is placed in compression, which helps keep them still and allows us to acquire good quality images. And then we take several views, and then those are reviewed by the radiologist.
Oftentimes, women let fear stand in the way of their health.
I believe that there's possibly a conception that it's a painful procedure because of the compression, as I mentioned. In all honesty, it can be slightly uncomfortable for patients. Typically, I hear people say that it wasn't as bad as they thought it was. So I think that fear might be overstated. The technologists here are excellent and take all the care to make sure that it's as comfortable as possible and position the patient, and that makes a big difference. And again, the positioning may be slightly uncomfortable, but the benefit of a screening mammogram is very, very high, so that we feel that is worth a slight bit of discomfort.
After the procedure is performed, images are then analyzed.
The mammogram is acquired, and then the images will be looked at by the radiologist, and we will categorize the findings as either benign, in which case the patient will just be coming back for their next mammogram next year, or there might sometimes be something that requires some further workup, be it extra views on mammogram, or perhaps utilizing other modalities such as ultrasound to further evaluate. It's not uncommon to have what we call a callback from a mammogram. In other words, a letter or notification that some extra images are needed. Something approximately 10% of screening mammograms will have that, so it's not uncommon. And most of the time we're able to either by those extra views or by ultrasound or some other way show that it's something benign and therefore is not necessary. So just playing the odds are that it's going to be something benign and not anything to worry about. And conversely, the reason that we're doing mammogram is to find things early. So if indeed there is something, again, that's what we want to do, is to find it as early as possible.
And the ultimate goal of every mammogram? To ensure optimal health and well-being. Well, tomorrow you'll have to stay tuned because we will actually be walking through a screening room to get a closer look at what the process of getting a mammogram looks like.